Hello, and welcome to today's presentation of our Tackling Toileting webinar series. Today is the fourth and final webinar in our series, and we are looking at bedwetting and challenging behaviors related to toileting. My name is Kristen Gunby, and I'm the behavior analyst on our subject matter expert team here at Autism Ontario, and I'm joined by my colleague, Bethany Bruin, who is an occupational therapist and also part of our team. For more information on Autism Ontario's language and professional statements, please see the document listed in the resource window, and we welcome you to submit your questions in the Q&A box below. We're going to do our best to answer as many as we can today.
So we're going to pick up where we left off, and if you haven't yet had an opportunity to view the first three parts of this mini-series, the links to access them are on our website and they're posted in the resource section. So the resource section can be found in the window below the slideshow. Today is part 4 of our mini-series, as Kristen mentioned. So we'll be sharing information about bedwetting, upset, and other challenging behaviors, as well as fecal smearing. So there's a lot of content that we are looking to explore today. Just a reminder that the content for this mini-series is also available in our new toileting guide. So if you have a chance, you can take a look at that in our resource section as well. And I will turn it back to Kristen.
Thanks, Bethany. So let's start by talking about bedwetting. Bedwetting is another way of talking about having a pee accident at night while sleeping. So in other words, wetting the bed. While you might feel your child's bedwetting is similar to daytime toilet training accidents, they're actually sometimes different. There's a lot of different reasons why a child might wet their bed at night, and some of these reasons might fall more under a medical lens. So it's important to keep this in mind when you're seeking help from a professional. In addition to the reasons listed on the slide, your child might also be more likely to wet the bed if there's a family history of bedwetting or if your child's experiencing some stress. Now, the Mayo Clinic has some suggestions for when it would be appropriate to seek help for individuals who are bedwetting. And these recommendations are not specific to autism, but they might help you in identifying when to get support. So you might want to seek support for bedwetting if your child's over the age of 7, if they were previously dry through the night and now they're experiencing bedwetting, if the bedwetting includes other unusual experiences like painful urination or feeling thirstier than usual. As we mentioned with the possible reasons for bedwetting, some concerns might fall more under a medical lens. So it's important to speak with your family doctor or pediatrician first, just to rule out any medical reasons for bedwetting. And then if your doctor feels it's appropriate, you can also seek the support of an occupational therapist or board-certified behavior analyst who have this in their scope of practice. And they might have suggestions for when to stop drinking fluids before bed, or the use of a moisture sensing alarm that we had talked about in part 3. And that's a device that hooks up to your child's underwear and clips onto the back of their pajamas, and it can signal when it senses moisture and sets off an alarm and wakes the person up. So these strategies can be helpful, but really you want to work with a professional so that they can do an individualized assessment and then support your child with an individualized plan. So I have an audience question here. My child is daytime toilet trained, but wears pull-ups at night as she wets the bed. Before bedtime, she sits on the toilet and we try to wait for her to go pee or poo. We give her an iPad to help relax her and stay on the toilet. But most times she won't pee or poo until she's in bed and then poops in her pull-up. Is there something we can do to encourage her to go to the toilet or go on the toilet before bed? So this is a little bit tricky because there can be a lot of different reasons for why this is happening, and it's difficult to pinpoint those reasons here today without an actual assessment. But it sounds like you're starting to notice some patterns. Your child's only really wanting to go pee or poo in a diaper, and those patterns can be helpful in determining the reasons why and moving forward with a plan to support your child. So in our toileting guide that's available in the resource section, we actually have a bedwetting journal or a data collection system where you can start filling out information on your child's evening and nighttime toileting routines. And then you can take that information to your doctor or pediatrician and rule out any medical reasons. And if they give you clearance, you can also give that information to a BCBA or an OT who have nighttime continence training in their scope of practice, and they can help individualize a plan for you. So they might suggest removing a diaper or using that moisture sensing alarm that we talked about, but really this is going to be an individualized plan that's based upon assessment and information gathering. Okay, so moving on to challenging or upset behavior. So your child might become upset or engage in challenging behaviors around toileting for various reasons. Sometimes children might be trying to communicate that they don't want something to happen. So, for example, a child might get upset when they need to have a bowel movement if a previous bowel movement was painful. Or some children might be trying to avoid a specific bathroom where they experience loud and unpredictable hand dryers and flushing sounds. Other children may be upset as a way to communicate that they do want something to happen. So, for example, a child might be upset because they want to use a specific bathroom, but they don't have a way to tell you this. So, during the toilet training process, it's also possible that your child might be upset when they have accidents. And this can happen when children who are used to wearing diapers are now in underwear. And they might be upset because they don't like the feeling of being wet or soiled, or because the accident signals to them that maybe they're not going to get a reward or positive reinforcement. Now, some researchers have found that when children with autism are upset as a result of an accident when they're toilet training, this can be temporary and may improve as the child learns to pee in the toilet. So, who can help you with this? Again, speak with your family doctor or pediatrician first to rule out medical reasons for challenging or upset behaviors related to toileting. This is important because if your child has a urinary tract infection and they're engaging in challenging behavior because they're in pain, those things are important to rectify before seeking help from an occupational therapist or board certified behavior analyst. But if you have clearance, then you can certainly seek the support of an OT or a BCBA. Okay, so what can I do? How can I help them? There can be a lot of different reasons why your child might behave differently than you had expected or even hoped. And it can be frustrating not to have the answers to support your loved one right away. If your child shows distress or discomfort, like crying, running away, or becoming aggressive with certain aspects of toileting, you should seek the support of a professional. Professionals are likely to investigate the underlying reasons for your child's upset behavior so that they can support with a plan to improve your child's behavior of concern and to prioritize learning ways to get their needs and wants met more safely. So, for example, if an individual is engaging in unsafe or challenging behaviors like running away when they hear a hand dryer in a public washroom, a professional may look at why. Maybe it's too loud for them. Maybe we need to come up with ways to support them with the unpredictability of that washroom sound, like muffling the sound initially with earplugs and systematically getting them used to that noise. Or maybe we teach them a way to communicate that it's noisy and that they want to leave. I see another audience question. How do I know why my child's engaging in challenging behavior? Is this about control? So different children have different reasons or what we would call functions of challenging behaviors. So they might want to try to escape or avoid something that's unpleasant to them, or maybe they want to access something they really like. Maybe the behavior serves a sensory function. And typically working with a professional like a BCBA or an OT will include some sort of assessment of what's happening and then come up with an individualized plan that meets the needs of that function. So for example, if the challenging behavior serves an escape or avoidance function, that might include teaching the individual to communicate those needs and then creating a new experience for them, whether it's making the environment more tolerable and slowly and systematically getting them used to a newer and safer way of doing things. So difficult to answer a specific question because interventions are unique and they're going to depend upon your child's unique needs. But I would say not so much about control, but more about, your child will have needs and wants just like everybody else. And it's about helping them get those needs and wants met in an easier and safer way. And now I'll turn it over to Bethany.
Thanks, Kristen. And just a reminder that you can feel free to add your questions in our Q&A function. We're answering questions as we go, and we will also have some time at the end, hopefully to get to any additional questions. So another common example of a challenging behavior that's encountered by parents of autistic children is what some may term inappropriate or risky poop behavior. So playing with or spreading around feces, and this is known as fecal smearing. So if we're wondering, why is my child smearing their feces? Just like Kristen mentioned, just like any other challenging behavior, there can be many different reasons. And understanding some of these reasons can be helpful to help work towards reducing this behavior. So some common reasons might include medical issues, things like constipation, diarrhea, and other gastrointestinal issues that we talked about in previous sessions. They can cause abdominal pain, and that can contribute to fecal exploration, including fecal smearing. There may also be sensory issues. Some children may like how poop feels in their hand, and they might like exploring the smell. Or on the other hand, some children might be extra sensitive to having that feeling of poop in their diaper or their underwear, so they may be trying to remove it with their hands. And then, of course, there are behavioral factors that we already discussed. So they might be using fecal smearing to meet a need or to communicate a need. So looking at who can help and the professionals that can help with fecal smearing, as in our other situations, we would want to check in first with our medical team, especially looking at those suggestions and strategies around consistent bowel movements. An occupational therapist might be able to look at some sensory tools and strategies that can help meet your child's need for touch or smell exploration. So for example, you might work together on developing a tactile exploration bin, a sensory bin. You might look together at baking or cooking activities or using aromatherapy to meet some of those smell or seeking behaviors. And a behavior analyst may be able to help you problem solve around what the function or the reason for the fecal smearing is, and then can help you to support you with a plan to teach your child to meet that need in a safer and easier way. So a helpful tip, as pictured here, you can check with your therapy team for recommendations or suggestions for types of clothing that may limit your child's access to their diaper or underwear. So one for sleeping might be, as pictured here, one-piece pajamas with fasteners at the back. We do have a few audience questions that are related to fecal smearing, or actually more specifically to wiping. So there's one question that says, my older child has poor coordination and always needs assistance with wiping. He uses his fingers to wipe. Do you think this is sensory related, and how can I teach him to wipe? And there's a similar question that says, how can I teach an adult to clean up after himself after going to the toilet? So if we're thinking about the action of wiping after a bowel movement, that's a great opportunity to revisit or review that idea of a task analysis. So that's where we were talking about breaking down a complex activity into simpler steps. So if we think about the task of wiping after having a bowel movement, there's actually a lot of components that might be involved, and an individual may have challenges with any or all of those pieces. So some examples of challenges might be with balance. So there may be challenges with sitting balance or postural balance or core strength. So maintaining that core stability and balance while turning or twisting to try and reach behind while wiping. There may be challenges with sensory awareness, or what we call tactile defensiveness. So from a sensory perspective, maybe having either the awareness to be able to feel, if you're using toilet paper or a wet wipe, to be able to feel through that toilet paper to know which part of our body we're trying to wipe. Or an individual may be extremely sensitive to certain kinds of touch. So they may not like that feeling of toilet paper or having a wet wipe either on their hand or on their bottom, or having their hands feel wet or messy. So again, you can look at working with your team, so your occupational therapist or behavior analyst, to help problem solve around what some of these challenges might be, and work together to try some strategies or solutions that everybody's comfortable with. There are also a few questions that are related to what we'd call regression. So there's one that says, my son was able to hold pee for more than 3 hours, but now he's not able to hold for even a short period of time. And there's another question that says, is a child regressing on their toilet training something to worry about, or is it normal? Any suggestions or strategies? So that will actually take us nicely into our next section, which is about toileting setbacks. So as with each stage of development and each skill your child develops, there's going to be times when you feel as though you've taken that proverbial 1 step forward and 2 steps back. So in other words, each time you start to feel excited that maybe your child is showing an interest in helping to pull up their pants, or they're starting to use toilet paper, or they want to turn off the tap, then maybe you have an equally frustrating moment where they poop in their underwear again, or they wake up to a wet bed. Setbacks are especially common during toilet training because there are so many different variables that can play a part in how your child is learning and responding each day. So some examples of the types of things that may affect your child's progress in toileting might be things like changes in routine. So their school schedule, that's going to be changing coming up soon, or taking a vacation or being in a different environment or location. Times of stress, as Kristen mentioned. So maybe if they're experiencing an illness or if there's changes in family dynamics. Just general growth and changes in hormones can have a big effect on toileting. Changes in medication, changes in eating or drinking habits. So that said, it's important always to keep your medical, therapy, and school teams informed about what's going on, these types of changes and challenges, so that you can problem solve together about adjusting strategies if needed. And if you're concerned about your child's progress, it's always good to check with a professional to rule out any of these underlying issues. So hopefully this series of webinars and our toileting guide has been helpful in your toileting journey by providing you with information on various toileting goals and helping you to understand which professionals can help support your child with their unique strengths and needs. You might be eager to get started, or you might be feeling completely overwhelmed. It's important to keep in mind that your feelings are important, and you can start small and maybe have a discussion as a family about what to prioritize, about how some of these common strategies that are used may or may not fit into your values and culture. If you feel comfortable, you can share questions, concerns, or apprehensions with your professional teams so that they can support you. On that note, remember to take care of yourself. Learning new skills around toileting can be exciting and challenging for your child, and it can also be exciting, challenging, and exhausting for parents and caregivers. You don't need to feel alone. Taking time for yourself and connecting with other parents and caregivers can be an important way to keep these things in perspective. So there's an old saying that says, it takes a village to raise a child. And if you can, reach out and ask for support from your village. That might mean help with dirty laundry. It might mean help with preparing a healthy meal, maybe taking your child to the park for an hour, or just by offering a listening ear. In addition to the professionals that we've already talked about who can support your family and your child, you may also look for support for yourself. Support from social work or mental health support, from your family, friends, neighbors, if you have connections with respite, and with your school team. And Kristen, I'm seeing here there's a question from the audience that says, my adult son has been toilet trained for years. He moved into a long-term care home 3 years ago and then started urinating in his bedroom. So he's not wetting the bed, but waking up, getting out of bed, and urinating on a pile of clothes or towels. This happens at night and early in the morning. Do you want to look at any suggestions?
Yeah, it's hard to answer this question without conducting an assessment first, but the positive parts of this question are that the individual is waking up with a full bladder. So that notion of interoception that Bethany had talked about in part 2 and part 3 of this series. So instead of wetting the bed, sounds like the concern started with the move to the new environment, where there can be factors that are different than what the individual's used to, and there's a concern with where the urine's ending up. So good parts are that they're waking up, but what we need to work on and support the individual with are that they are urinating in the wrong location. So we'd encourage you to work with a professional like a BCBA or an OT with this in their scope of practice to determine if they have suggestions for how to support that individual during the night, maybe using a toilet or a commode in the room to urinate in. Maybe they'll suggest a moisture sensing alarm to bring awareness to people around that individual that they need support getting to the washroom. And maybe there's some environmental supports that they might suggest, like lights or cues placed around the environment to help. A professional can really help with an individualized plan that's based upon an assessment.
Thanks, Kristen. That's really helpful. And just a reminder, as we mentioned, it does take a village, and that's our hope here at Autism Ontario, is that we can be part of that village to help you with some support. So feel free to check out autismontario.com for further resources and further support as needed. And then I think Kristen will go over some takeaways from today's presentation before we get to a few more of your questions.
Yeah, so to summarize today's discussion about bedwetting and challenging behaviors, here are some key takeaways. There can be many different reasons for bedwetting and many different professionals who can help to support. Be sure to check with your physician first to rule out any medical factors. Professionals can support with investigating potential underlying reasons for upset and other challenging behaviors, and seek support from your professional team and personal network as you tackle toileting. And now we'll have some time for some questions.
Great. Thanks, Kristen. So just a note, as we're answering questions, you can see our tech team has those sort of pushed through so that people can view the ones that we're answering. So as you're sending your questions through the Q&A, you might not see them show up right away, but we'll try to get to as many of them as we can. So we do have a question that says, is it true that a child's bladder might not physically be ready to hold their urine overnight? And I think that speaks exactly to what Kristen was talking about from that sort of growth, development, hormonal, medical perspective, that there are definitely different factors involved in toilet training during the daytime and toilet training at night. And there is definitely a developmental sequence to follow to be able to kind of be at that readiness stage for toilet training overnight. So thanks for bringing that up.
I see some questions about individuals that are not wanting to use a bathroom outside of their home. And so that's very common. The environment that you get used to at home can look very different to an environment in a public place. There can be noisy hand dryers, different smells. There's a bunch of different stalls versus at home. You have your own private bathroom likely. And so that's very common. What I would suggest, whether you're working with a professional or you want to try this on your own, I would suggest starting small. So maybe not expecting the individual to fully urinate in the toilet, wash their hands and everything right away. Maybe start with something small, like just quickly going into that washroom and coming out. Maybe they go in and they, I don't know, give you a high five or take something off a counter, or, just grab a piece of paper towel, just something small, so they can be successful in that other environment and build from there. Maybe it's just a quick little visit at first. You can ask them to just get you something or take them with you, just open a door and slowly build from there, because it can be really hard and really overwhelming with the environmental differences from one place to another. And if you're just starting on your toilet training journey, it can be helpful to start using different washrooms from the get-go. If somebody's already just toilet trained at home and they're feeling uncomfortable, then I would say start small and build in different environments. But if this is a new learning experience for your child, they're just starting on their toileting journey, it can be helpful to avoid that preference for one environment over the other by starting to use other bathrooms right from the get-go.
That's great, Kristen. We have a question around, my child is daytime toilet trained, but he still wets his pants when he's focused on an activity. What can I do to help? So if we think back to our earlier presentations, we were talking about that idea of self-initiated bathroom visits versus scheduled bathroom visits. And that was looking at your child's ability to identify when they need to go to the washroom, that sort of interoception or internal awareness of what's going on in their body, and being able to stop an activity and then take a break to go to the washroom. So that's kind of what we were talking about earlier. And one suggestion you might have if you're working with a therapy team, they might look at using a timer or using a schedule, kind of like we talked about earlier. So having those special times, if there's something that you know your child's going to be really involved in, if they love playing with Lego, or maybe they're having their screen time for the day, maybe there's a timer that you set as a reminder so that they can stop partway through that activity and work on that transition to using the washroom if they don't have that awareness quite yet to be able to stop on their own. And that is also a common factor too, that even if they do have the awareness and they need to go, if they're really involved and really excited about something that they're doing, often it's hard for them to be able to stop and move on and transition to a different activity.
I see some of those questions about cutting drinks off before a certain time, before you put your child to bed. So that can be helpful. I'm apprehensive to say, yes, cut fluids off at this time, because we don't know how much your child drinks throughout the day or what the circumstances around fluid intake are for your specific children. But that can be one of the factors that can help. What I would suggest is using the toileting journal, the nighttime toileting journal in our toileting guide, to start looking at the patterns of what your child and your family are doing at night as like a baseline. you can add in there when you give the last drink and look at, the number of accidents, and then if you make one change, like you stop giving fluids after a certain time, look at the effect of that. If you just keep filling out that toileting journal, that'll kind of give you an insight onto whether that is going to work for your child or not. So starting with collecting data would be my suggestion to start. And then if you are going to make the change of limiting fluids after a certain time, continue to take that same data, fill out that same nighttime pee journal, and just look to see if there are some positive changes in the right direction based on that.
And I think that's a great point, Kristen, about data collection and using those journal and data collection tools as you're sort of planning and looking at different strategies, because that can be helpful in a lot of different ways. We have questions too about, my 7-year-old is still wearing pull-ups at night. He really has accidents during the day. How would you recommend starting the process if medical issues are ruled out? And I think that would be my suggestion too. Again, if you're working with a therapy team, they're probably going to want to have some data collected on how often he's having accidents, what time of night he's having those accidents, how much he's had to drink before, or what time he had something to drink beforehand. So it's always helpful to have that information collected, and then you might start to notice some of those patterns on your own, and it'll also be a great tool to use with your therapy team. So that's a great starting point.
I see a question here of somebody who's already working with a behavior therapist, and there's occupational therapy knowledge here too, but they're having trouble with having this individual sit without the diaper for a bowel movement. That the individual is refusing. They prefer to stand and to wear a diaper. So sometimes you get into these complex situations that might involve a more interdisciplinary approach. And so maybe you're looking at a medical and dietary lens as well to help encourage more like easier bowel movements to come more frequently. Maybe you're looking at, the behavior analyst could be looking at fading the diaper. There's been some research showing that you can, cut holes in the diaper so the individual kind of feels like the diaper's still there, but there's still a way to get that into the toilet. You could also do some like reinforcing of sitting more often, maybe sitting before and after the toilet. So there's a lot of things going on in this scenario. And so maybe for that individual, it's more of an interdisciplinary approach, and you need to look at having a number of different individuals work together on this concern.
We have a question around, my son has been toilet trained for several years. He tends to let out a bit of pee in his pants, but not enough to make his pants fully wet. So I guess the family's identifying by smell, not by sight. And he seems unaware that he's doing this because he doesn't seem to mind the feeling or the smell. Kristen, do you think this would be an opportunity if they were working with a team to use that moisture sensing alarm that we were talking about?
Yeah, it can definitely bring awareness by sensing moisture and setting off that alarm. Again, as I mentioned in our previous series, that you really need someone to help you identify the right alarm, because there's alarms that sound really fun and then it becomes a little bit of a game. Like, I'm going to pee because I want to hear this nice song that it plays. And then there can also be sounds that can be a little bit scary, and then somebody can start withholding because they don't like that sound. And so it's about finding that sound, or some of them have like a vibration to them. It's about finding the right sound so that it notifies you and the individual that something's happening, but it's not too scary and it's not too fun.
Yeah, so certainly the purpose of that moisture sensing alarm is to be able to pair those two things so that your child develops an awareness that when this sensation is happening, this is what it means. So I think we only have a little bit of less than a minute left. I'm wondering if there's any other questions we wanted to address. And thank you so much, everyone, for adding your questions in the chat. I'm sorry that we didn't get a chance to get to all of them. Certainly, please feel free to check our resource section and look at that toileting guide, because a lot of the information that we've just talked about is all included in there.
There is a question here on BMs and wiping, and I know that Bethany had gone through a question very similar to this in part 2 of our webinar series, so we would encourage you to have a look at that.
Yes, that idea of sort of checking the paper to make sure when it's clean and using that as a guide. So it looks like we're right at 12:30. Thank you everyone for joining us. Thank you for your patience with our technical difficulties over the last few sessions. Hopefully this was helpful today, and hopefully we were able to get to a few of your questions. And we look forward to seeing you at one of our next sessions.
There will be a survey that pops up when we're done, so we really appreciate if you have time and you can fill that out. It just helps us improve presentations moving forward and gives you a chance to voice ideas for future presentations.
Thanks everyone for joining us.